We started to see lots of other conditions get better, and some were unexpected. We eat, so there's food energy, which is calories. And as we eat, your body can store some of those calories. It can store it as glucose and it can store it as body fat. So if you have too much glucose, which is type 2 diabetes, or if you have too much body fat, which is obesity, then if you don't eat, then your body will simply use the stores of glucose and body fat. And that's highly beneficial in this situation. So of course, if you don't eat, then blood sugars get better. So if you don't eat, your good body's going to burn, it needs energy. So it's going to burn either glucose. So if you have type 2 diabetes, it can get much better. Or it's going to burn body fat. So if you have, obesity, it can also get better. And that in itself is a huge, huge benefit. So there's so many benefits to, that because type 2 diabetes puts your body at risk of basically every disease under the sun. So it puts you at risk of heart attacks and strokes and cancer and blindness and amputations and kidney disease. So that in itself is huge. Obesity puts you at even higher risk of all kinds of other things: back pain, knee pain, osteoarthritis, so many other things. And we know that that's well established. So those two by itself are have massive benefit for other conditions. However, people started to see sort of lesser known benefits. So some people started to see improvements in their autoimmune diseases, for example. And the why it works is a little bit unknown. However, it's thought that as you put your body into fasting mode, it's going to naturally shut down some of the body systems in order to sort of preserve energy. And one of the systems, perhaps, is if your immune system is excessively stimulated, that is an overactive, then perhaps your body may start to bring that back under regulation. So some people with some autoimmune diseases notice that it got a lot better. There's not a lot of data for that because the studies still need to be done, right? However, we hear people who say my arthritis got so much better, this got better, that got better. So it may have a benefit there. People also notice that they had more energy than before. When you fast, your body doesn't actually start shutting down, which is what everybody thought. In fact, when you fast, what happens is that your body upregulates or increases other hormones, including your sympathetic nervous system. And therefore, people actually had more energy. They could concentrate better. They could think more clearly. And some people, and you also have an increase in growth hormone with fasting. And again, some people, I had a friend who had significant problems with his joints, tennis elbow and all these sort of things. So he was like, oh, because he works out a lot, and he's like, oh, he's just getting old, that sort of thing. But then he started fasting, and all these problems just went away. And he's like, that's incredible. And he thinks that it perhaps maybe it's been the growth hormone, because again, if your growth hormone is elevated, then you're going to be able to repair tissues and so on. Yeah, so it can certainly help, and the fasting is one of these very important um, reasons that people, if you're going to lower your weight, for example, that weight is going to cause increased heart disease. If you lower your sugars, your type 2 diabetes, that's going to cause heart disease. So therefore, through those mechanisms, for sure, we know you can lower your risk of heart disease directly. It probably has beneficial anyway. There's this hyperinsulinemia, which is, seen in a lot of people. So it's also called insulin resistance, which is metabolic syndrome. So not just the diabetes, but this whole metabolic syndrome, which is like high blood pressure and all these other things. That can be improved by fasting as well, and that's going to directly impact the risk of cardiovascular disease. With the kidney disease, again, it's probably more indirect, and probably because type 2 diabetes and high blood pressure are the two biggest causes of kidney disease. And both of them are generally helped when you have when you do intermittent fasting. So, if you get rid of the type 2 diabetes or your blood pressure comes down, then you're going to help the kidney disease because those are two biggest risk factors for progression of kidney disease. So intermittent fasting can help sort of in that way. Well, because fasting reduces the type 2 diabetes, reduces the glucose, also tends to reduce the blood pressure. Because so fasting lowers insulin levels because insulin goes up when you eat and goes down when you don't eat. So when you fast, insulin goes down. Insulin not only, helps you gain weight and store energy, but it also tends to cause retention of water. So it tends to make you sort of keep water, which pushes up your blood pressure. So if you lower the insulin, you're going to typically have lower glucose and lower blood pressures. And both of those are very important for progression of kidney disease. It's generally basically the two biggest risk factors for progression are diabetes and high blood pressure. So fasting can help both of those. Your brain can use one of two fuels, glucose, and it can also use ketones. So ketones are produced when you fast, and also when you have a low carbohydrate diet, like a ketogenic diet. What happens is that your brain can use glucose or ketone. If your brain isn't using glucose as efficiently, then by doing fasting, you can start to produce ketones, and then your brain can start to use those ketones for energy. And a lot of people think that a lot of mental disorders and a lot of depression and a lot of dementia may be related to the fact that the brain simply is not getting enough energy. So if the brain can't use the glucose and you're just giving it glucose, then that's a problem. However, if your brain can't use glucose, but you're giving it ketones, then it gets better. So a lot of people feel that it may be a very interesting way to get people to improve their brain function. There's not a lot of data because, again, these ideas are relatively new. Studies often take, a few years just to get the funding and then a few years to actually design and do the study and then another year to produce. So people only started thinking about intermittent fasting maybe 5 years ago, seriously. So then to get the funding and do the studies for this just takes time because nobody's looked at it. But it's a promising area for sure. So a lot of the data hasn't come out yet. People are still sort of wrapping their heads around it. It was very funny because the studies always lag behind. So we went from and there's been a number of studies on intermittent fasting, and a lot of them say, oh, well, there's no benefit compared to chronic calorie restriction, although that's questionable. And I thought it was funny because it went from something that you should never even think about or do to somehow supposed to be better than any other diet out there. It's like, okay, well, that's quite a change in a few years. So that was, but as a practice, it's something that's available to everybody. They don't need special permission to do it. They can do it themselves. They don't need any special equipment. It's free. So it is something that people can use and experiment with for themselves.